And we're on the patellofemoral trip today. So let's talk about another option to stabilize the kneecap, a tibial tubercle osteotomy, or TTO.
So when you do a TTO, you're actually moving the bone to line the knee up better. It's essentially to bring the patella into the groove. And it's a good operation for stability, but it's a good operation also for patients who have anterior knee pain because it can unload the kneecap and take the stress off of it.
So we're all built differently, and sometimes the kneecap sits too high, or sometimes the tracking is really off, and the TTO can improve both. And it's an incredibly effective procedure. A lot of surgeons don't do a lot, so there's sometimes reluctance to even propose the surgery to a patient. But it is one of the strongest techniques to stabilize a knee.
So when we do a TTO, we make a small incision on the outside part of the front of the shin bone. The surgery takes about a half an hour, and we fix the bone when we move it with 2 screws. And since there's not a lot of fat or muscle overlying this area, a lot of people can feel those screws. So in many cases, we take the screws out sometimes 6 months, 9 months after surgery. And that's not a very big deal operation.
That's usually no brace, no crutches, and people after a few days feel just fine. And in terms of small incisions, it's about the length of a finger. So sometimes you see these big incisions online, but that's not what we do.